Hi, I'm Lanisha Robinson, your host for Career and Technical Education, #Build a Future. Our goal is to show a variety of the career and technical education CTE programs we have within St. Lucie Public Schools. These programs are leading the way directly into the workforce for many of our students. Students are earning industry certifications, participating in state and national level competitions from the skills learned directly from their CTE classroom. We at St. Lucie Public Schools take pride in knowing our CTE students are actively closing the skills gap needed in our community. In this episode of Career and Technical Education, #Build a Future, you will meet with Mr. Erik Bartkowiak from Treasure Coast High School and learn how these students are getting the leading edge. Hi and welcome. Please go ahead and introduce yourselves. We'll start with Mr. B first.
Hi, I'm Erik Bartkowiak. I'm a medical academy instructor at Treasure Coast High School. I've been a registered nurse for 20 years. Worked in a variety of hospitals in the area and both out of state.
Okay, all right, and then?
My name's Montana Coffey. I'm a student at Treasure Coast and I'm in the medical program.
My name's Nathaniel Housen. I'm also a student in the medical program at Treasure Coast High School.
Okay. All right, so Mr. B, so you work with the Allied Health program, which is what we call the Medical Academy. How long have you been working at Treasure Coast High School?
I've been at Treasure Coast High School for 2 years now.
Okay. And can you give us some information on your educational background?
Sure. My educational background, I have a Florida and multi-state RN license. I have a bachelor's degree in nursing from Western Governors University and an associate degree in nursing from the University of Massachusetts.
Okay. So it's very important, as you all know as students, that your teacher, whoever's teaching you, especially in a medical academy, have some background experience. So can you tell us and enlighten us regarding what is your background from nursing? Like, why is it that you are the best for these students?
I appreciate you saying I'm the best for these students. My background is predominantly in emergency medicine. Over the 20 years, I have worked in a variety of fields of emergency medicine. I've worked in trauma, I've worked in community medical centers, I've worked in large university teaching medical centers, I've worked as a flight nurse, both fixed wing and helicopter. And I've also worked in administrative positions in emergency medicine and as well as in hospital administration as well.
Okay. So with you all right, so we have Nate and Montana. Can you all tell us, like, how is that important for you all to have a teacher like Mr. B to have that background? Why is that important for you all as students?
Honestly, like, a lot of the time I'll ask, like, well, when would we use this in, like, the real world? And, like, because he has, like, all that experience, he's able to tell us, like, firsthand things that he's been through. So that's what I like, mostly.
Yeah, I feel like him having that amount of experience allows for us to ask questions to him, and he'll give us back answers that we can actually use and things like that.
Okay. So Mr. B, how do you stay current in the field? Because we know every day and every year, every moment is something new coming out, something the medical program is evolving in some way. How do you stay current and up to date with that to be able to share it with your students?
Well, I continue to work per diem in a local hospital in the emergency department there. I try to do 1 to 2 days a month to stay current with what's the latest trends are, what's changing in medicine, because everything changes every day. And there's always something new coming out. There's always some new evidence-based practice. And since these students will be using that in their future, I think it's important to stay current and bring that to them so that when they go to their educational programs and onto their careers, they have relevant information to take with them.
Okay, very nice. So can you also tell us, give us an example of if we were to shadow a student in your class, such as these two, what are some either skills, demonstration, products that we will see in their classroom?
So these students attain a number of industry certifications. They attain a certification as a certified medical administrative assistant, learning the ins and outs of both the front and the back office portions of medical practices, medical clinics, medical centers. They also earn a certification to become an electrocardiogram technician, to be able to perform on-the-spot electrocardiograms for cardiologists and other physicians in order to give them therapeutic data to treat the patient. Then they also have the opportunity to obtain a CNA certification, which is a license with the state of Florida as a certified nursing assistant working in long-term care setting and the acute care hospital setting. And additionally, they also are able to get an emergency medical responder certification, which allows them to treat and to diagnose and to treat a myriad of emergency medical symptoms from obstetrics all the way to geriatrics. So the number of experiences that they can take on in any given day is very wide-ranging and really fits anywhere between the boxes of the lifespan from birth all the way to old age and death.
Wow, okay, very interesting. So with you two, I mean, Mr. B has mentioned how many certifications are students getting, essentially? That's about, what, four you mentioned? 4 different certifications. So with you two, we'll start with Montana. Can you tell me what certification that you have earned so far? And you haven't even graduated high school yet.
I have my CMA certification and my EKG certification.
Okay.
I'm testing next week to take my CNA certification, and then next semester I'll be enrolled in the EMR, and then hopefully furthering my education after that.
All right, good. All right, Nathaniel?
Well, I basically have kind of the same certification that she has. I have CMA, and I have EKG, and I'm also going to be testing next week or in the next 2 weeks to get my CNA certification.
Okay. So with the CNA certification, you two both mentioned that you're taking your exam basically next week.
Yeah.
So what are you doing to prepare for that, to make sure that, hey, I'm ready to go, I can pass this exam, Mr. B has done this, we're doing these items. Can you enlighten us and tell us about what exactly can we see in the classroom? If we were to come into the classroom today, what will we see in the classroom?
Well, usually in the classroom we'll be working on mannequins, or we'll be using each other as patients, and we'll be practicing skills you see in the nursing homes and in those types of fields. And we also use, like, on class, we'll use other types of, we use like other online learning applications where we'll.
Yeah, I'm more of a writer and like typer. Like I need to like see it visually and then like do the skills. So I like made like a whole Quizlet thing for it, and then like I practice the skills like with people, and like whenever I'm in class I like go with someone, like grab someone and like start off, like I'll do a skill and then like they'll be the patient and like switch on and off, like doing it like that. I feel like that helps a lot because practicing it like before we went to the nursing homes was like okay because like you get the gist of it, but then to do it like to a real patient, that was probably like the best part.
And because it's different than the traditional educational environment where you're learning math or you're learning biology, for instance, we run a very student-led classroom where the students lead a lot of the learning that takes place. I just provide them the guidance based on the curriculum that we have and what is going to be on the testing that they'll take, what kind of things they'll be asked to do when they get out into the real world. Because in medicine, when you're working in the profession, there is nobody instructing you on how to do this, and there's nobody leaving you solely to make these decisions. These decisions are made collaboratively, they're made within a group, and that change from the traditional academic setting of sitting down, learning something, taking a test, and getting your grade is very different than this, where this is a very collaborative environment where they need to work with each other and learn how to share answers and use strengths and weaknesses of each other to get things done. So.
Okay, nice. All right, so can you also, you've mentioned, your CNA testing, you've mentioned what it takes to pass. Can you tell us about what is your current passage rate?
So we exceed the state average. Last year, our average was 83% of the students that took it passed on the first time. Wow. And then subsequent students were able to retest and pass as well. The great part about that is currently we have 10 students that are working in the local area, in the profession. 8 of them are working in local long-term care facilities using their CNA license. 2 of them are working in an acute care hospital responsible for overseeing the cardiac monitors of over 120 patients at a time. and one of them is actually working as a physical therapy assistant at a local hospital. So.
Wow. So these students have actually taken the knowledge and their skills, their industry certification, and moved on to the next level at their graduation and actually working currently in the field.
Indeed, and more importantly, they're working locally here where the demand is incredibly high with long-term care facilities opening up all the time, recent expansion of the local hospital, more homes being built, people are moving into this area, the demand is incredibly high. So to be able to turn out people that can hit the ground running in the field that they want to work in as they further their education, I think is a huge benefit to the community.
Yes, it is. Completely 100% agree with that. So with that, what exactly do you all want to do once you have your certification and you graduate from high school? What do you want to do with that?
I mean, personally, I'm still trying to work it out and think of what I want to do in the future because it's a big decision. But I'm hoping that getting this license will give me the head start and maybe get some experience and get a job where I can hold down for a bit while I make that decision.
Mm-hmm. So basically like an entry-level position, you can get your foot in the door with these certifications.
Yeah.
Good. All right, Montana?
I want to do pediatrics because I just really like kids. And I know that I want to stay in nursing because I just like to help. So I feel like starting a CNA because that's like the bottom, like I could work my way up and then eventually get to what I want to do.
Okay. So when you say pediatrics, like a pediatric nurse or a pediatric doctor? Or?
I want to eventually be like a nurse practitioner, but I know that throughout like my experience and my education, I'm going to change my mind. So whatever happens, happens, but I know that I definitely want to stay like with kids.
Okay. All right. Now it's important with technology. We talked about earlier that everything is always improving, is getting better in some way. Now, how is technology? Do you use technology in your classroom?
So starting in the early parts of the medical program with your anatomy and physiology, where the emphasis is on learning the structure and the function of the body, we have a great tool. It is a virtual reality dissection tool, if you will. It allows us to take apart the human body while it is still working and see the actual function of it as we take apart the structure. It's called Z-Space. The students sit at this monitor and they essentially dissect a live body as it moves, something that would be impossible to do in the classroom setting otherwise. So a great piece of technology that lays the foundation for them early on in the program so that they can understand the body, and then as we move forward, it becomes very hands-on at that point where it's very patient-centered. And the students, we have mannequins in the classroom that are extremely lifelike from head to toe. A lot of the procedures that students perform on these mannequins are the same that they will perform on the students, and having them be anatomically similar creates that ability for them to put what they learned in the classroom into action in the patient care settings.
Okay. All right. So as students, what do you all think about Z-Space and that having that technology available to you all?
I think it's a really cool tool. Like I've used it before, and it allows me to look at things that I can't with normal mannequins or other students. It allows me to take things apart and look at them closer, and yeah.
I like because you could look at like each individual system. Like when I was doing my EKG certification, I remember Miss Loop's classroom had that too, and that was like I would go on it like every single day just to look at like the heart and like circulatory system, because like that, like seeing it, like seeing how it worked, and like having like, because you put on like the little glasses and then like you do it on the computer, and like seeing it like there really helped me a lot.
Okay, so your classroom is innovative. It's using technology. It's using up-to-date what's out there right now for your students that get the most out of their education. That's what you all are doing. So that's very, very awesome. Can you all explain to me how many courses is actually in the medical academy? Like how many courses is it? Like 4, 5, 3? Like how many courses can a student expect to take?
The medical academy consists of 2 basic courses that you have to take as prerequisites. You have to take anatomy and physiology, health science 1, again where you learn that structure and function of the body, that baseline. Then the second course is called Health Science 2 Foundations, where you learn about the inner workings of the healthcare system, how insurance works, what type of healthcare settings are out there, what kind of professions there are within the healthcare system, what these professions do. You learn basic safety, infection control, all of the important things that you're going to need regardless of what career you choose within healthcare. Then we have that broken down after that into career tracks. If a student wants to become, they feel like maybe they want to pursue a nursing track, or they feel like they want to pursue a more of a medical track as, say, a physician, or they want to take a more therapeutic or diagnostic services track, physical therapy, x-ray technician, and whatnot. Then that's where the other electives come into place, such as the CNA, EKG, CMAA, EMR, these other courses that prepare them to do the actual work that they want to start off in those entry-level positions.
Okay, all right. So with you two, what tracks have you all chosen?
Well, I mean, I've started with the anatomy and physiology, but I eventually moved on to CNA because I felt that one was more attuned with what I like doing. I like helping people, and I like being closer to people. So with this course, I feel like it kind of lines up with both what I like doing and what could benefit me in the future.
So you've, like, basically the nursing, the CNA route, that's the route you have taken, Montana?
Yeah, because I know that I want to do nursing, I know that I should stay in the CNA program, but I wanted to get as many certifications as I can on my way, so that's why I signed up for EMR and CNA.
Okay. So let's kind of talk about a little bit more with the emergency medical responder. What exactly, can you give us a little bit more details on that? Do you all go outside the classroom? Is there any exposure? What exactly, any students, what can they do with that?
Sure. So emergency medical responder, in my opinion, is probably it is one of the hardest classes within the medical academy because you are truly concentrating on every potential emergency situation that can arise from obstetrics all the way to geriatrics. So everything within the lifespan that you could imagine could possibly happen in an emergency scenario. So as you can imagine, it's incredibly hands-on and it's incredibly knowledge intensive, learning these different things, learning to do the actual hands-on skills and diagnose these emergencies, make sure the scene is safe, perform the actual treatment, then get the patient packaged up and ready to move on to the next level of care so that they can continue their treatment. This prepares students to work on ambulances. I think it provides a great basis for students to work in the acute care hospital setting as well as patient care technicians. For students that want to go on to work in medicine, for instance, as doctors or as nurses that aren't really sure where they want to work, what area, what specialty they want to do, it provides them all of those specialties at one time, and they can say, wow, you know what, I was really intrigued by the pediatric population, or I was really intrigued by the geriatric population, or obstetrics. It allows them to make that decision and kind of funnel themselves into something that they have a passion for and that hopefully they'll be able to make a career out of in the future.
Okay, so essentially you all have to do out of the classroom some kind of exposure outside the classroom, correct? What exactly, how did you do that? How do you achieve that?
Sure, so once again we work with simulated patients with our mannequins and in conjunction with the drama department and moulages and different kind of simulated scenarios. In addition, we work with St. Lucie County Fire Department in an Explorer program where the students can also ride along with them on the ambulance, and also out of the school settings in local emergency departments where students get observation time where they can see these things that they learned in the classroom and how they're treated in that setting and what the ramifications of what they learned in the classroom have out in the real world.
Okay. So with the two of you all, have you all done any like clinical work or anything that Mr. B has mentioned? What's your experience with that?
Yeah, we've actually been to a nursing home recently. We went to Tiffany Hall where we worked with elderly people, and we kind of went along with the other CNA. They kind of paired us together. So there we took care of the elderly. We performed some tasks, but we can't perform all of them because it's not in our scope of practice. But we did what we could to help them out and make the job easier with them.
Okay. Okay.
Yeah, we got a lot of like experience from it. Like I like the fact that, like I said before, like it wasn't like working on a mannequin, like just walking up like, oh hi Miss Jones, and no one's talking. Like it's a real person, like with real emotions, and like seeing like how like the different patients reacted was like a big thing. Like there are certain people that you walk in and they're just perfectly fine. They talk to you like nothing's wrong, and then you go to another room and someone like is not all there, not completely able to tell you how they feel, and it's just fun. It's just funny to see like how different each patient really is.
And that's really the eye-opener for them, is understanding that the mannequins in the classroom don't have feelings, they don't move, they don't react to anything. They're there for you to use. These are live people that are, they have reactions, they have feelings, they have a life that is different from what you've maybe worked with before, and how that affects your ability to put that treatment in. It's, for me, it is one of the most profound parts of the academy, is to watch those students interact for the first time with live patients, because the human dynamic is wide-ranging, and for some of the students, this is the first time they've dealt with that, and it really pushes them outside of their comfort zone. And so we have this kind of saying that they need to learn to be comfortable being uncomfortable. And you know, at 16 and 17 years old, dealing with somebody who is dying for the first time, for instance, is incredibly difficult. And with this outside clinical experiences, they're able to get a sense for that.
Do you all, what is your biggest challenge for you two as students going into basically, like you said, a nursing home? What has been the biggest challenge from you?
I feel like one of the biggest challenges is trying to deal with all the different types of patients, because like she said, nobody acts the same. Some people will be easier to deal with. They'll talk to you, they'll tell you everything they want or how they feel. Other people can't communicate that properly, and you kind of have to be patient with them, engage what they want slowly. So I think that was one of the biggest challenges, dealing with the other half of patients.
Okay, thank you.
Yeah, like each person, like that was like one of the things I learned, like that each person or each patient, like you have to treat them differently. Like he said, like one person you have to be like louder with them, or one person you have to be like watch what you're saying, like with certain things. Like it's just different with each person.
So with clinical work, is there like a certain amount of hours that students must achieve every year or every so often? Like how does that work with clinicals?
So every certification has a different requirement for hands-on clinical time. I'll speak specifically to CNA, which is the strictest, because it is a state license that the students obtain. The state of Florida grants them the ability to work as a certified nursing assistant in long-term care settings, hospital settings. This is also transferable to any other state in the country as well. So it requires that there's 40 hours of outside clinical time, in addition to all of the classroom simulation time. 20 of those must be in the long-term care setting with actual hands-on patient time. The other 20 is up to the discretion of the instructor in a variety of scenarios. For instance, we work a lot with a lot of the ESE students within the school. We have an agreement with the instructor there, and we've spoken with her. And these are students with developmental disabilities, with intellectual disabilities, that for them, it's incredibly difficult situation when they have to go to the doctor. And for the students, it's incredibly difficult to work with students that can be unpredictable, that are very different from what they've ever dealt with before. So for both populations, it serves a great purpose, because the students with the disabilities get used to these medical treatments, and they get used to these medical procedures. They get to interact with their fellow students in a setting outside of their normal classroom. And for the students in the program, they are learning compassion, they're learning empathy, and they're also learning to work with people that can be unpredictable, people that are uncomfortable in these situations, and how do I make them comfortable? And a lot of on-the-ground thinking has to take place. So that is a lot of time how we fill our other hours. We also do them in outside clinical settings as well.
Okay. Now, can you tell me, because I know it's important that students are also involved in career and technical student organizations, can you tell us what's available for students that are in the Allied Health Medical Academy?
Sure. So the largest opportunity is with a group called HOSA. HOSA is the Organization of Future Health Professionals. The club meets in the school. They have an advisor who is a teacher in the medical academy. It's a very student-led organization. They have large national meets, state-level meets, where they participate in various competitions, medical terminology, career-minded projects based on what their field of interest is. We encourage the students to participate in that. There are also outside externship opportunities available, local businesses, chiropractors, local physicians that want to offer students that have these certifications the ability to come and see what it's like in the real world setting and test run it, if you will, and in the hopes of then gaining future employment and keeping these people within the community and within the industry.
Okay. Do you ever bring in like guest speakers or have your students go outside and maybe do like any college field trips? You all ever do that?
So the most important part, I believe, is bringing in these professionals to tell the students how that real world works, if you will. That it is not all roses and birthday cake sometimes, that it's a hard road, and the struggles that they took going to get to the position that they're in. I have a local emergency room physician come in who started off as a molecular biologist and didn't like that and went to become a CNA and worked as a CNA, then became a nurse and felt like that wasn't enough. He wanted more, and then went on to go to medical school later on in life, and then finish his residency, and then move on to become an emergency room doctor. And that road, for the students to see that the path isn't always as straight as you may think it is, that there are twists and turns, but at the end of the day, if your eye is focused on that goal, that you can make that.
Right. Okay, so because you all have shared with us so much information, so much that you all do in the classroom every day, what has been the most beneficial part of the program for you two as students?
Well, I think that the experience we gained is something that we've benefited from a lot. We've been able to gauge how we'll work with other students in a classroom. We've been able to see what a workspace experience is actually like. So I think the experience is a good thing.
Okay.
Yeah, I just get the experience is a really big part of it, because I feel like if you didn't have those first-hand experiences, you wouldn't really completely understand. Because I can say that from when I first started the academy and I was just doing it on mannequins or one of my friends in the classroom, it was nothing like how it was when I helped the first person at the nursing home. But that was probably the experience and stuff.
Okay. What if you had a student that was maybe coming to Treasure High School out of the 8th grade, and they're kind of confused on, well, what academy do I choose? Or, what would you tell them if they say, hey, what is a medical academy truly like? What would be your recommendations, or what would you actually say to them?
Well, I think one thing I would definitely say, like our teachers here said before, is you gotta be ready to be uncomfortable, because this isn't something for everybody. It's worth giving a shot if you're ready to challenge yourself, but the thing is, it is not for everybody. You gotta be ready to be uncomfortable and deal with some stuff that you're probably not used to before. But I also think it's a beneficial learning opportunity that you can apply in different areas of your life.
Okay. Montana?
Yeah, it definitely is not for everybody. Anyone that's ever asked me about joining the medical academy, I've always told them if you genuinely don't love it or don't see yourself doing it in the future, I wouldn't bother wasting your time, because it is a lot of work and it is a lot of dedication, and if you're not willing to put it all in, give it your all, then you might as well just not even do it.
Okay. All right, so we need to wrap up. All right, it's been a pleasure having all of you here. Can you sum up for us basically what are the highlights for the Medical Academy as we prepare to close?
So the biggest benefit of this academy is you leave high school with the ability to obtain an entry-level healthcare position in the field that you want to work in the community that you live in, that can support you as you move through the educational ladder. Between the matriculation agreements with local colleges where you receive college credit, to the certification that allows you to get these jobs that are in high demand, that pay in the mid-teens per hour, far better than what your peers may be working in fast food and these other industries that are out there. And you're working towards your ultimate goal of working in healthcare.
Okay.
To me, that's the biggest benefit.
All right. Well, I appreciate it, and I thank all of you all for coming.